Autism, more accurately known as autism spectrum disorder or ASD, is one of the most prevalent neurodevelopmental disorders which affects how a child communicates and interacts with others. Autism begins early in childhood and lasts throughout the life. It is estimated that about 1 in 100 children has autism around the globe. Autism is 3 to 4 times more common in boys than girls. Remember that early diagnosis can make a huge difference in the lives of autistic children and their families. But unfortunately, it's not always easy to make a proper diagnosis. Diagnosing autism can be difficult because there is no medical test, such as a brain imaging or blood test, to make a diagnosis of the disorder. So we are supposed to look at the child's developmental history and behavior to diagnose autism properly. That's why every child needs to get an assessment at their 18 and 24-month checkups to make sure their development is on track. In general, features of autism fall into 2 main categories. The first one is lifelong impairment in social communication and interaction. Trouble interpreting what others feel and not understanding abstract concepts, spending more time to process information or answer questions, repeating what others say to them, which is known as echolalia, being insensitive and indifferent, rejecting cuddles and preferring to play alone are some common examples of autistic children's communication and interaction problems. Second is restricted and repetitive patterns of behavior, interests, or actions. The world looks like a very chaotic and confusing place to autistic children. Because of that, they often prefer to have routines so that they know what is going to happen. Additionally, these behaviors are enjoyable and help them calm down during stress. Hand flapping or rocking and using an object repetitively like spinning objects are 2 common examples. On the other hand, changes to their routine can be very distressing and make them feel very anxious. Other neurodevelopmental conditions are common in autistic children as well. Anxiety disorders, attention deficit hyperactivity disorder or ADHD, depression, disruptive behaviors, and tic disorders are common associated comorbidities. Autism does not have one specific cause. Researchers believe that autism is influenced by both environmental and genetic factors that inappropriately change brain development, particularly neural connectivity. Speaking of brain, keep in mind that a brain with autism is quite different from a normal one in many aspects. Electrophysiology, neuroimaging, and autopsy studies have revealed that autistic children have a larger brain. This can cause brain hyperconnectivity, abnormal brain structure such as greater amount of white matter, and abnormal brain chemical concentration. These pathological changes can develop characteristic features of autism in affected children. A big question is that what makes a child at risk for autism? The truth is that autism has no single known cause. Genetic factors, advanced parental age, and environmental factors all play a role in autism development. If you know any other factors that can enhance development of autism, let me know down in the comments. As we mentioned earlier, autism is much more common in boys than girls. Moreover, its prevalence highly increases in siblings. Monozygotic twins are more likely to share autism than dizygotic twins as well. These imply that hereditary background plays a role in autism development. It is estimated to be 40 to 80% heritable. In the past decade, hundreds of genes have been identified that contribute to development of autism. According to genetic studies, chromosomes 1, 3, 7, 15, and 16 are involved in autism pathogenesis. Another risk factor is parental aging. Both paternal and maternal aging can raise the risk of autism. Studies show that parents in their mid-40s are 5 to 10% more likely to have a child with autism than are 20-year-old parents. In addition, men over 55 are 4 times as likely to have a child with autism as men under 30. The most likely explanation for the association between autism and parental aging is that number of mutations in sperms and egg cells increases with parents aging. Various environmental factors, including toxins, teratogens, and perinatal insults, are associated with few cases of autism. Prenatal infections like maternal influenza, rubella, and cytomegalovirus or CMV infection, maternal zinc deficiency, maternal diabetes, abnormal melatonin synthesis, exposure to certain drugs and toxins such as valproic acid, thalidomide, psychiatric drugs, organophosphate and organochlorine pesticides, and finally, perinatal stress owing to complications of labor and delivery are shown to be associated with an increased risk of autism spectrum disorder. Thanks for your watching. Please let me know the medical topics you're willing to learn. Write them in the comments for me, and good luck.